Well, now we turn to the biggest updates on the coronavirus this afternoon. Almost 39,000 people in the U.S. have died from COVID-19. There are more than 734,000 cases across the U.S. But there's some optimism today. China, where the outbreak all started, reported 16 new cases yesterday. That is the lowest daily increase since mid-March. House Speaker Nancy Pelosi says Congress is very close to a deal to put more money into the small business loan program. Last week, the $350 billion Paycheck Protection Program ran out, with many small business owners still seeking help. In the last hour, North Carolina reported more than 300 new cases of COVID-19 and 8 new deaths. The state's death total is now up to 172. And think about this. That is higher than the number of flu-related deaths in the last 6 months. COVID-19 hospitalizations are up by more than 20% today. About 6,500 people in the state have tested positive out of more than 78,000 tests. Mecklenburg County only reported 25 new cases today. Now in South Carolina, there are 4,200 confirmed cases and 119 deaths out of more than 38,000 tests. The state will update those numbers later this afternoon. New at noon, a group of state senators are now calling on Governor Cooper to open Charlotte Motor Speedway for a fanless Memorial Day weekend race. The Republicans from our area think that it might be another step toward normalcy. They say Florida has adopted a similar policy, and NASCAR has demonstrated that it can run fanless races while social distancing. Senator Vicky Sawyer is part of this group, and she said that the state should look at every safe example of a way to partially reopen society, and fanless racing seems like a simple step. Well, we're hearing from the team of researchers and health experts that'll help the governor make the decision to reopen the state. The team released a study on what the effects of reopening the economy would have and recommended the now familiar dimmer switch approach of slowly opening parts of the economy. It says that should include rapid testing and contact tracing, along with watching hospital capacity and PPE supplies for hospitals. It says each phase should include time between steps to see the impacts that each one has. Now that means that it could be a while before life returns to normal. The study says, quote, society's responses to it will be part of our lives for a long time, and that even as we reopen, we need to embrace social distancing practices to protect both public health and the economy. But it said the only true long-term solution is to fully eradicate the virus or to develop a broadly effective and safe treatment for the virus. Well, Channel 9 has learned that a Mecklenburg County nursing home has an outbreak and more COVID patients are being relocated to that facility. An email to families of Huntersville Oaks residents says that the patients will be in a separate wing and employees will be limited from working in multiple parts of the building. Family members we spoke to are both shocked and concerned about the news.
It's unfathomable to me why you would bring something that is known to be like the most virulent disease that known to man, and bring it into a nursing home that has residents there who are the most vulnerable segment of society.
Now, we asked Atrium about their decision to bring coronavirus patients to the nursing home, and they said they could not answer those questions at this time. One of the biggest issues about the virus is how long it's taken to get many people tested. And now we're getting insight into why it took so long. Officials from the FDA tell CNN that the problem was with how the CDC originally made that test. In mid-February, the CDC reported that the test was malfunctioning. By the end of the month, the FDA and CDC figured out one of 3 pieces of the test had a design issue or might even possibly be contaminated. New tests were made and then shipped out. The Health and Human Services Inspector General expects to complete the review of testing by next year.